Okay, let's dive into something pretty much every dog owner faces eventually. That unpleasant moment, you know the one?
Oh, yes. The sudden, messy surprise, diarrhea.
Exactly. It's messy, it's definitely worrying, and you instantly want to know what's going on and how to fix it, like right now.
Completely understandable. And, well, that's what we're digging into today, acute diarrhea in dogs. We want to help you figure out when it's maybe just a minor upset versus when you really need to be calling your vet.
Right, we're going to try and cut through some of the jargon, make it clearer, because honestly, the list of things that can cause it feels huge
It
sometimes.
really is a wide range. Could be anything from, grabbing some dodgy scrap off the pavement to something more serious health-wise.
Okay, so with all these possibilities flying around, where's a good place to start trying to get a handle on it?
Well, probably the most common reason, especially for sudden onset, is what vets call dietary indiscretion.
The fancy term for my dog ate something gross.
Basically, yes, your dog ate something they shouldn't have. And interestingly, younger dogs, say under 3, seem to do this, well, statistically about twice as often as older dogs. So something to watch out for, especially with pups.
Right, the four-legged vacuum cleaner strikes again, like
Yeah.
dropped food, the bin raid, maybe some questionable street treat they found.
Exactly. And rich or fatty human food is a big trigger too. Table scraps can definitely cause trouble.
Okay.
And it's not just the forbidden stuff.
Well,
Even
yeah.
switching their normal food too fast, like a new brand of kibble or treats, without a gradual transition that can really upset the balance in their gut.
That makes total sense. It's like if we suddenly ate completely differently, our stomachs might complain too.
Precisely. Your system needs time to adapt.
So beyond what goes in their mouth, food-wise, what else is common?
Well, believe it or not, stress and anxiety.
Really? Stress causes diarrhea.
Oh, absolutely. Think about travel, boarding kennels, moving house, even just separation anxiety, especially in puppies. There's a strong gut-brain connection in dogs. Stress hormones can directly mess with their digestion.
Wow. I wouldn't always connect those dots immediately, but it makes sense their body would react. Okay, what about when they eat things that are definitely not food?
Ah, yes. Foreign objects. Very common, particularly with puppies exploring the world with their mouths.
Like toys, socks.
Yep. Small toys, bits of bone, fabric, even rocks or pebbles. And the danger there isn't just the diarrhea from trying to pass it, but the huge risk of it causing a blockage.
A blockage sounds serious. How would you even know?
Well, one major warning sign is if your dog keeps straining to poop, but only small amounts of watery stuff where nothing comes out. That needs urgent vet attention.
Okay, critical point. Straining but no real result equals emergency. Got it. What about actual poisons?
Right, toxins. That's another really serious cause. Things like chocolate, which is definitely toxic to dogs, certain plants, some essential oils if ingested.
So if you even suspect poisoning.
Straight to the vet. Immediately. No hesitation.
Okay. And sometimes it's not something they ate, but something they were given, like medicine.
That's true. Some medications, antibiotics being a prime example, can disrupt the good bacteria in their gut. That disruption can lead to diarrhea as a side effect.
Right. Okay, so we've got dodgy food, stress, weird objects, toxins, meds. What about tiny things, invisible invaders?
Good point. Parasites.
Hmm.
Things like roundworms, hookworms, whipworms.
Yeah.
Also Giardia and coccidia, little microscopic nasties.
Hmm.
And again, puppies are often more susceptible because their immune systems aren't fully developed yet.
Makes sense. And even smaller than parasites, viruses and bacteria.
Yes, definitely. Viral infections like parvo, distemper, coronavirus, these are really serious, especially for unvaccinated or young dogs. They cause severe diarrhea and other life-threatening signs.
Parvo is terrifying.
Yes, and bacterial infections too. Salmonella, Campylobacter, can cause significant gut upset.
So these are mostly acute things. Are there longer-term sort of chronic health problems that show up as diarrhea?
Yes, several. Inflammatory bowel disease, or IBD, can cause ongoing or recurring bouts.
I've heard of that.
And colitis, that's inflammation specifically of the large intestine, often causes frequent small amounts of diarrhea, sometimes with mucus or blood.
Okay.
Then you have things like pancreatitis, issues with the liver or kidneys, even certain types of intestinal cancer. Food allergies or intolerances can also manifest as chronic diarrhea.
Wow, it really is a massive list. And there were a couple of others you mentioned, something hemorrhagic.
Ah, yes. Hemorrhagic gastroenteritis, HGE, that's usually very sudden, severe vomiting and quite bloody diarrhea, looks dramatic, and it is serious.
Sounds it.
And one more, EPI, exocrine pancreatic insufficiency. That's when the pancreas doesn't make enough digestive enzymes.
Mm-hmm.
Dogs with EPI often have really large amounts of sort of pale, greasy, foul-smelling stool.
Okay, my head is spinning slightly with all these causes. It's a lot. So the million-dollar question for someone listening, how do you tell if it's just a wait-and-see thing or a get-to-the-vet-now situation?
That is the crucial thing, isn't it? Knowing when to worry. Because while, yes, one random episode in a healthy adult dog might not be panic stations,
Right.
there are definite red flags you need to watch for.
Okay, like what tips the balance towards calling the vet?
Well, frequency and duration are key.
Mm-hmm.
If it's more than just 1 or 2 episodes, or if it keeps happening, that's a concern.
Mm.
And definitely if the diarrhea lasts longer than, say, 24 to 48 hours, time to get it checked out.
Okay, persistence is bad. What about the dog itself? Does age matter?
Hugely. Very young puppies, very old dogs, or any dog with a known health issue or weakened immune system, if they get repeated diarrhea, don't wait. Get them seen much sooner.
Right, more vulnerable. And we talked about straining, potentially meaning a blockage. What about what the diarrhea actually looks like? Does that tell us anything?
It can give clues, yes. Seeing blood is always a reason to call the vet.
Bright red blood. Or dark.
Either. Bright red blood, called Hematochezia, often means bleeding lower down, like in the colon or rectum. Dark, tarry, blackish stool, called Melena, usually suggests bleeding higher up, like the stomach or small intestine, where the blood gets digested. Both need checking out.
Okay, blood equals vet call. Got it. Any other symptoms that should ring alarm bells if they happen alongside the diarrhea?
Yes, definitely. Things like unusual drooling, vomiting, especially if it's frequent or has blood in it. Also, if your dog just isn't interested in food or has completely lost their appetite.
Lethargy, too, like just not themselves.
Exactly. Lethargy, weakness, those are significant signs. A dehydration is a big risk with diarrhea.
How can you tell if they're dehydrated?
Look at their eyes. Because they seem sunken or dry. Is their nose dry? Check their gums if they feel dry or sticky instead of wet. That's a sign.
Sticky gums, okay.
You can also gently lift the skin over their shoulders or back. If it stays tented up instead of snapping right back, that indicates dehydration too.
Good tip. Any signs of actual pain?
Yes. If they yelp when you pick them up, or if they do that prayer position front end down, plumb in the air that can signal abdominal pain.
Right.
Also a fever, or if their belly looks swollen or feels hard or tense. All reasons for a vet visit.
Okay, that's a really helpful list of warning signs. But let's say it is just a mild case. Adult dog acting pretty normal otherwise, maybe you just had 1 or 2 bouts. Is there anything safe to try at home first?
For those specific situations, mild, recent onset, adult dog, otherwise bright and normal, yes, there are a couple of things. Sometimes a short fast, maybe 12 to 24 hours, can help settle things.
Just water during that time.
Absolutely. Always provide fresh water. But, very importantly, fasting isn't usually recommended for puppies, elderly dogs, or dogs with other health conditions like diabetes. Check with your vet first if you're unsure.
Okay, good caveat. So after the fast, or if you skipped the fast, what then?
A bland diet is usually the next step.
Yep.
For maybe 24 to 48 hours.
What counts as bland?
The classic is plain boiled chicken. No skin, no bones, mixed with plain cooked white rice. Plain canned pumpkin is another popular one. Make absolutely sure it's plain pumpkin, not the pie filling with spices and sugar.
Right. Crucial difference.
Yes. Other options could be a little plain yogurt with live active cultures, maybe some dog-specific probiotics, peeled boiled potatoes, bit of low-fat cottage cheese, or plain scrambled egg cooked without oil. And vets often have special prescription gastrointestinal diets, too.
So simple, easy to digest stuff. How should you feed it? Big meals.
No, better to offer small amounts frequently throughout the day. Helps the gut handle it better.
Okay.
And then, once the stools are looking firm again, you gradually mix their regular food back in over maybe 2 or 3 days. Don't just switch back suddenly.
Gradual transition back. And water.
Absolutely critical. Keep that fresh water available constantly to prevent dehydration. Your vet might sometimes suggest diluted, unflavored Pedialyte for electrolytes in mild cases, but always ask them first.
And take it easy on walks and stuff.
Yes, rest is good. Avoid strenuous activity while their system is recovering. Let them chill out.
Makes sense. Now, flip side. What should we absolutely not do when our dog has diarrhea? What are the big no-nos?
Top of the list. Never, ever give human medications without explicit instructions from your vet. Things like Pepto or Imodium can be harmful, even toxic, to dogs.
That's so important. Easy to think, oh, it works for me, but definitely don't.
Exactly. Also, Avoid giving bones. They can irritate the gut further or even cause obstructions.
Right.
Hold off on treats, especially rich ones, and any table scraps until things are totally back to normal.
Right.
And don't make sudden big changes to their main diet long term without discussing it with your vet first.
Okay, so pulling it all together then.
Yeah.
It seems like, yeah, mild diarrhea might crop up sometimes, and maybe some simple home care like a bland diet can help.
Often it can in those straightforward cases.
But the real key is knowing those warning signs we talked about, the blood, the vomiting, the lethargy, the dehydration, the duration that tell you this isn't simple and you need professional help.
Precisely. You need to look at the whole picture.
Hmm.
How your dog is acting overall, what the diarrhea looks like, how long it's going on, and any other symptoms.
And we have to say, of course, while we hope this conversation has been useful and maybe shed some light, it's absolutely not a replacement for getting proper advice from your own veterinarian.
Couldn't agree more. This is for information, for education. But for a diagnosis and treatment for your specific dog, you need to see a certified vet. Please don't try to guess or use human meds on your own.
So the final thought for you listening is really just be observant. Know your dog, know what's normal for them, and if something seems off, especially with something like diarrhea, don't hesitate to make that call to your vet. Better safe than sorry when it comes to our furry friends.